This is Pauline Agwang, a senior anesthetic officer at Kiruddu National Referral Hospital. With a smile, Agwang attends to her patient who has just undergone an operation. She says their work is to provide a conducive environment for any surgery.
In simple terms, we make people pain-free during surgery, with or without sleep.
Anesthesia is a medical specialty concerned with the total perioperative care of patients before, during and after surgery. The work of these specialists starts in the ward rather than the theatre where operations are carried out.
When we get a theatre list, the surgeons put up a list to show you that these are the patients we are going to work on. So it is my duty to follow them on the ward. Then I go and see the patient, look at the patient, know what operation is to be done on the patient, and then I talk to the patient to first of all know whether he's aware that he's coming. You know, people fear surgery.
At this level, she says, they determine whether a patient is ready for an operation or not and make recommendation to the surgeons.
So like we request for some tests. So they take to the lab and they will do the tests. Then we look at the tests and see, is this patient fit for surgery?
Where we are standing is where the patients ready for surgery start from before they are taken into theatre for any operation.
Like this one is on her way out, while that one is waiting to enter.
Agwang says she was moved to switch from midwifery to anesthesia on realizing the high demand for the anesthetists.
At least now is better, but before there was a big shortage. So we could always find shortage with the anesthetists. And the hospital was willing to sponsor people who wanted to go for the course. So because of the need, that's how I saw that I really need to do this course.
On this occasion, we were allowed into the theatre to appreciate what exactly happens in there.
So we have different types of drugs. Now, the ones which make the patient sleep, we always give them through the IV. So like if I'd prepare this one. It looks like, because we have to put this into your trachea. Then we connect it into our machine, such that now I will breathe for you. This is oxygen. As the operation is going, I keep reducing. So when they are finishing, then I put you off. So this is what keeps you sleeping.
Knowing that for the period one is undergoing an operation, she determines how long you stay asleep. She shares the worst experience during the entire operation.
The most challenging times in anesthesia is when you get a heart arrest. That one, nobody wishes to experience it.
Dr. Robert Odongo, the head of General Surgery Unit at Kiruddu Hospital, explains that having a successful operation requires teamwork.
However much I'm the one going to operate a patient, I won't take the credit. I know a nurse who is going to assist me, or I know the anesthetist who is here going to run this machine here and make sure that my patient is very comfortable. And then I know even the cleaner who actually comes to clean the blood that has maybe dropped on the ground, or even the iodine that has poured down, or the one I'm going to call and say, come and possibly give me another pair of shoes to change. So all those people play a very important role.
He emphasizes the importance of anesthetists during the process.
And when the patient is here, they'll make the patient as calm as possible. And after we are done with our surgery, they always come and help out the patient recover well and ensure that we are stable and fit to leave the table.
This is one of the theatres here at Kiruddu National Referral Hospital. When a patient is brought here for any operation, they're immediately connected to this monitor that the anesthetist keeps monitoring throughout the operation. That is how important they are. Any mistake could cost the life of a patient. Benjamin Jumbe, NTV.